My name's Aurelis, and I'm here to talk about everything nursing. So today I'm going to talk about my reason for quitting my job at a rehab. So prior to nursing, I really wasn't much of a quitter. I would just stick it out and suffer no matter how bad the job was, right? But in all reality, that should never be the case. If you're not happy at a job, you need to quit it. You need to get out of there. There are always better options. You're always going to have ways to make money, especially when you're someone with a degree, a career, etc. Okay, guys, so I got licensed in February of 2020, and at that point, I had been applying to jobs, searching for jobs, and because I didn't have a license, no one was calling me back. So my naivete was, oh my God, I need a job right now. I'll take whatever I can get. I'm so desperate. So I I got a call back finally because I was able to put a license number on my resume. That made such a huge difference. And I kind of jumped the gun because this person calls me, and she was the DON of this rehab. So she's the director of nursing. And she just goes like, hey, so I got your application here. Do you want the job? And I was like, yes, because I just wanted a job, you know? And so nothing was discussed, not what hours I would work, not what days of the, like what my schedule would look like, nothing was discussed, what my pay would be, what insurance coverages I would have. Nothing like that was discussed. So that was my bad. Okay, so that kind of helps me segue into my first reason why I quit. It was ridiculously disorganized. I was basically offered a job knowing that I had no experience, having had not, they didn't interview me. They did a BS interview when I came in to fill out paperwork, and it was basically my first day of orientation. And so I was told I would have 3 days of training, which as a nurse is ridiculous because most people will train you 6 weeks. My current job will train you for as long as you feel comfortable. So I work at a hospital now, and they train people for up to 10, 16 weeks at times if they don't feel comfortable or they don't feel ready to be on their own yet. And so I got 6 weeks of training because I had prior hospital experience, and even before that, I got like I was in a new grad program, and I got like a solid 8 weeks of training prior to being let loose. And even then, it was like I had people there to touch base with, right? So at this nursing home, the way it would work, it was ridiculous. Like I was I was training, and this other girl was training with me. And after the second day, she was just like, "Oh no, we gonna kill somebody, girl. Like we got like I'm not coming back." And I was like, "Oh my God, really?" And she was 100% right. Like I should have just followed her. But I was so obsessed with like security and having money coming in somewhere somehow that I was like, "Well, I'll just stick it out until I find something better." And so, which was stupid because literally a few days after I started this process getting hired by this nursing home, I was called by a large city hospital to come in for temp work. And honestly, that temp job turned into my current full-time position. And that was just me being impatient and feeling insecure financially. So I got this job. I was training for 2 days. On the third day, which I was still supposed to be training, they were short staffed. Someone had called out. They had no coverage. So the girl who was training me was like, well, I have to take over this whole other side of the floor. And I was just like, so I'm going to be handling all of this by myself, like 20 something patients. And she was like, well, I'll be here if you need me, which was false because obviously if she's dealing with like a crap ton of patients and I am too, we're not really like crossing paths like that unless there's an emergency and we have to call everybody in or something, which was also systemically not the best, right? So thank God I personally never had an emergency. But if, let's say, someone was, unresponsive, I would literally would have to resort to yelling down the hallway for a help because there was no system in place, no buttons to push to get someone in the room. Okay, so I felt like it was incredibly unsafe to like have a completely novice nurse on her own within just 3 days of training. And then the DON had the nerve to be like, when the girl was training me, like, oh, let her do it, let her do it. She just graduated, she knows everything. When anyone who's anybody knows it's the complete opposite. You graduate, you know things in theory, and like even then, like some people don't know a lot. Like they could just finesse a test or whatever. So hands-on training is very important, and they just overlook that. And so then there were just several scenarios where I felt unsafe because I didn't know something, or I didn't know how to set something up, or I felt concerned about a patient, and I would report that, not like officially, but I would go to whoever go to whoever was in charge, and nothing would ever get done. Okay, so the second reason why I left, a lot of it had to do with feeling morally conflicted every time I would go to work. There are people who do not have a vocation for this job. Whether you're a nurse or a CNA, what have you, I've played both roles, and honestly, you have to care about people. So if you don't care about people, just don't do it. Don't do this job, okay? Because there are people who are handicapped, who are disabled in some sort of way, where they cannot clean themselves, where they cannot feed themselves, whether it's a stroke, an accident, cancer, whatever is riddling them and making them so weak that they cannot be home and their loved ones cannot take care of them. That is why they're at a rehab. They're trying to get back to where they were before. And so or they're elderly, and they're demented, so they have no place to go other than a place where they can be supervised 24/7. But the thing is, when someone's demented, right, they're confused all the time. They don't know where they are, who they are, what's going on. It does not help when you're constantly short staffed, and then on top of that, you're supposed to get this supervision that really you don't really get, right? And then when you're dealing with someone who's disabled or handicapped because they had like a major stroke, or they have like really severe cancer and they can barely move because they're in so much pain, you know, they might not be able to call, or they need to get checked on frequently. And frankly, if I have 20 something patients, I can't round on you. I work at a hospital now, and I have 5 patients at a time. And, some med-surg floors go to 6, 7, depending on where you live and, how the hospital flows. But that's really hard. That's really hard to be able to go to each patient in a timely manner, like within the hour, and see how they're doing. Especially if they're a patient that cannot fend for themselves. It is really heartbreaking. Well, at least for me, it was really heartbreaking to go to one of my patients and they tell me, I've been calling and no one's come, and I've been wet for a really long time, at least an hour. And that does egregious things to your skin. It breaks down your skin. No one wants to hear that. I'm like, where were you? Or I would, ask a CNA, like, why didn't you tell me this person? Well, she's too heavy, like, we need 2 people. Well, if she's too heavy and you need 2 people, you get me, and then we can coordinate when we can both go in, so that she's not sitting in her own piss for an hour, and it just be like little things like that would just set me off. I would just get into arguments with people, and that brings me to my third point as to why I quit. It was just a toxic culture. Like, in terms of, there was a lack of respect from the CNAs, because a lot of them were older, and they older than me, and they saw me like as a young kid, because I look younger than what I am, apparently. I don't know. But I was just like, no, like, we need to do this job. Like, I'm not going to take everything on. You have a responsibility. I have a responsibility. Why are you taking a 20-minute bathroom break? I wish I could. I'm barely getting a lunch. You know what I mean? And that would suck. Or like nurses who would call out all the time. Like, there was a situation where this one nurse, like, I don't know what was going on in her personal life, but she was calling out all the time. People were starting to get concerned about her, like maybe she was, doing some extracurricular activities prior to coming to work, and there were just a lot of like sketchy things going on with her. So there were a couple times where she would call out, but then she would come in late, and so everything would be done. But like, I just worked at 12. Now no one can find you coverage. I can't just abandon these patients, and it's now a 16-hour, 17-hour shift, and that's not fair to me. And the fact that there wasn't people there to kind of like, even when you tried to advocate for yourself, like they just didn't care, like that, just like I don't care mentality. And then there were some older nurses, like there's a saying that goes, nurses eat their young, you know, and it's true, like they fucking do, like they definitely, there was this mentality of like, you don't know anything, you need to set everything up so that when I come in, no one needs anything. Like they wanted us to pass their night meds for them before the shift came in, if they worked nights, because I was working days and at the time. And I was like, why am I passing your meds? Like, that makes no sense. So I would just flat out refuse. I mean, don't ever let anyone try to bully you into doing their job, because you have a job to do, they have a job to do, and stand up for yourself. I don't care if you are a new grad, if you're 20 years old or 45, does not matter. You matter just as much as anybody else. And so the other thing too that I wanted to touch on, and the last thing, is the pay. It is ridiculous how little they pay you when you work at these nursing home rehab situations. Like they are ridiculously underpaying people. And you take on more work, like more physical work, you're tired. Like there were nurses there that had been there a year, 2 years, and they were literally traumatized from working there. Like just talking about work made them cry. And I'm like, I don't want to be you. I don't want to be you. And so that's why I just like, I was like, I can't do this anymore. I quit. So I quit because I had been emailing a couple people about new grad programs, because I was working at the hospital like per diem. It was a temp position, right, while I was doing the nursing home thing. But then I just kind of got fed up one day, and I'm like, I can't do this any longer. I'm so unhappy. I did not change my career to go from an unhappy career to another unhappy career, especially when you're watching YouTube, Instagram, like all these nurses who are like balling outrageous because they're traveling, or they got a good new grad, they got into a really good new grad program that like covers everything. And I'm just like, I'm worthy of that too. I'm worthy of that. This is beneath me. I can't do this anymore. And the differentials were stupid. It was like $2 to $3 differentials to work nights. Like, are you kidding me? And you like, and I felt like I felt as if I was thinking more about the physicalities of nursing. I felt like a glorified CNA almost, because I was not able to use my nursing processes, right? So it's definitely a skilled job, but at the same time, if you don't prioritize it, you'll end up just being a working horse. And that's not fair. That's not why we went to school. That's not why we did what we do. So I ended up quitting. I can honestly say I make significantly more money working at a hospital. It's a lot more organized. It's smoother. The culture isn't toxic. It doesn't matter where you work, there's always going to be somebody who's like a mega bitch. Like, there's going to be someone who just like that doesn't, you don't mesh with, you don't work well with, like whatever. That's going to always happen. But I'm someone that pretty much does pretty well working with other people. I get along with most people in the work setting, but everybody, you don't rub everybody the right way. People want to test your boundaries. You're the new person, blah, blah, blah. So I've had 2 hospital jobs since then. And I did a new grad program on a telemetry floor, and now I'm on a HEMONC floor. So they're very different but very similar. Both hospitals have a lot of similarities, except one is grander than the other. And I feel like once you get down your basic nursing skills, you can be a nurse anywhere. Like, traveling is something I've also contemplated, because after transitioning from one hospital to the other, I'm not seeing a huge difference in terms of like pay and long-term benefits. Like, Yes, one's a little better than the other, but when you're talking about a difference between a $4,000 monthly check to a $5,000 weekly check, that is just, it makes you ponder a few things, you know? So I definitely think if you just started out with nursing and you don't love it, if you don't love your job, you don't love your floor, just find something else. Find something else. Use it as experience and move on. There's no reason to stay somewhere you hate or that you don't like. I don't know what it's like to be a nurse outside this pandemic, and I've had so many roles in a short period of time that probably would not have been the case prior to COVID. The need is so high for us right now that the world is our oyster. So don't settle for just a stupid basic job. Get something good, get something that's gonna pay you, take the risk, and you're going to be fine. Well, that's all I have today. Feel free to contact me with any questions you might have or any ideas that this video might have brought up. And I'll catch you on the next one.